A war exists in healthcare. It's a war that has been plaguing the nursing profession for more than a century. This war brings with it injuries and casualties. This war is well known but rarely spoken about in public. What is this war? It's the war between the day shift and the night shift. On this episode of Coffee and Conversations about Nurse Bullying, we're going to talk about how to end the shift wars in nursing. Hi, I'm Dr. Renee Thompson, the CEO of the Healthy Workforce Institute. Welcome to Coffee and Conversations about Nurse Bullying. All right, the day shift nurses think that the night shift, they just sit around all night long, sucking the liquids out of bonbons. The night shift nurses think that the day shift, they're the favorites. They get all of the support, all of the resources, all the food, all the fun. So what do nurses do? They fight. Not overtly. Oh no, their weapons are a bit more subtle, but equally as lethal. Weapon number one, dumping. Nurses deliberately leave work for the next shift, work that they could have done but chose not to. They retime the meds so that they now appear on your shift, conveniently postponing that CT scan of the head for later, and somehow leave all of your patient's IV bags dry, to the point where now you have to get on new tubing. Weapon number two, they withhold information. Nurses, forget to let the next nurse know that the physician wanted to be paged as soon as the patient's wife arrived. The physician rounds, finds out the wife has been there for over 2 hours and flips out on you. Weapon number three, they leave a mess. There were times when I had to clean up the patient and the patient's room before I could assess him. And by the way, you can tell when someone's been incontinent for a long time. You know I'm speaking the truth, and nurses complain constantly about being short-staffed. However, is it the number of nurses working, or is it the nurses? We have to stop this war with our counter shift. Care happens 24/7, and ultimately, when you dump on the next shift, withhold information and leave everything a mess, you're impacting their ability to provide good care to your patients. Let's adopt a new game plan. Instead of coming up with ways to make things more difficult for the next shift, why not go out of your way to set them up for success? How can you set the next shift up for success? Try any of these. Leave a courtesy bag in the patient's room if they're on continuous IV fluids. If they're having a procedure or test that day, print the patient's education materials and hand it to the next nurse so she doesn't have to look it up. Anticipate any supplies he or she might need and put them in the room. Warn the oncoming shift nurse about any behavioral issues. I once had a patient who kept trying to catch the nurses making mistakes. He would give you the wrong birthday, wrong last name. Thank goodness the nurse before me warned me, okay? Remember, care happens over a 24-hour period of time. It's not 12 hours or 8. Not just days or nights. And by setting up your coworker for success, you're ultimately helping that patient get well enough to go home to his or her family. So let's stop this shift war and start setting each other up for success. All right, what are ways that you can support your coworkers on the next shift? I've just given you a few. Please leave other ideas in the comment section below. And if you like this video, make sure you subscribe and share it with your friends. And if you really want to learn more about how to address workplace bullying and incivility and all that other badness, just go to my website, www.healthyworkforceinstitute.com for more resources. Until our next conversation, be kind, take care, and stay connected.